everyone. My name is Kelly Mazzio. I'm the intake supervisor at Options for Community Living. I've been with that agency for about 15 years. We've been around since 1982, and we're very fortunate to continue to grow. We started out with housing. Our beds, we continue to get grants and things like that. We're mostly in Suffolk County for housing, but we do have supportive housing beds in Nassau. And we also have a bunch of community services, care coordination. We have care coordination for people with a mental health diagnosis and or people who are diagnosed with HIV. We have HIV housing, home and community-based services, and mobile residential support team.
Hi, I'm Leslie Lusterman. I'm the Associate Director of Residential Services for Transitional Services for New York. We're primarily a Queens provider. We have we have every single level of housing that there is. So we have the 24-hour supervised community residence programs that are staffed 24 hours a day for people who really need a lot of assistance, a lot of working with people on activities of daily living, providing rehabilitative services to get people to greater levels of independence. Then we also have apartment treatment. So that's scattered site apartment program where staff they're housed off-site, but the program is staffed 24 hours a day, and the staff could be in any apartment probably within about 10 or 15 minutes. Staff can come to the apartment every day if that's needed. They can supervise medication in the apartment, which is a big plus. We also have a registered nurse as part of that program, so we have some beds set aside specifically for people with chronic health conditions, and we have some beds for people who also have a mental health diagnosis and an intellectual disability, so they're visited every single day, and it's a very low ratio. We have one case manager for every 4 residents and those 2 specialized populations. And then we also have supported housing, which is also considered permanent housing, scattered site apartments all throughout. We're in pretty much every single neighborhood in Queens. It'd be hard to find a neighborhood where we don't have at least one apartment. And the way supported housing works, and supported housing seems to be the program that most people are usually interested in. People pay 30% of their income towards the rent. So let's say the rent is $100 a month and 30% of their income is $200. They pay $200 and we pay the additional $800 for the rent. So their rent payment never changes unless their income changes. So even if the rent is increased on the apartment, right? Landlords today, we know, especially in Queens, what we're going through with trying to find affordable apartments is really outrageous. That doesn't affect the tenant in the apartment at all. Again, it's permanent housing. They never have to leave. All of our other settings are what are considered more transitional settings where people work with staff for a couple of years and move on to something more independent. In supported housing, no one ever has to leave. And we also provide case management. So the requirement is that we visit people at least once a month. But if somebody needs additional services, we take a lot of people straight from homeless shelters, long-term, people who have been at Creedmoor for a very long time or other state psychiatric centers, people from adult homes, all different settings. And some people really need a lot of assistance with kind of reintegrating into the community. So staff can be there every day in the beginning. It's as little case management or as much case management as the person requires. Everything is always individualized. And we can also take people from the community. So someone who just comes to us and says, I have a child who's mentally ill. We're struggling at home, and also someday we're not going to be here, and we'd like to know that they have a place to live and that there are people looking out for them. We can take those people as well. I think that's probably enough for me right now. Right?